Hey everybody, and then now welcome to the vocabulary lesson 133rd, which is the second part. So this is the second part of the 133rd. So now I'm going to be still talking about the lightheadedness right here. So the topic overview. Dizziness is a word that is often used to describe two different feelings. It is important to know exactly what you mean when you say, I feel dizzy, because it can help you and your doctor narrow down the list of possible problems. Lightheadedness is a feeling that you are about to faint or pass out. Although you may feel dizzy, you do not feel as though you or your surroundings are moving. Lightheadedness often goes away or improves when you lie down. If lightheadedness gets worse, it can lead to a feeling of almost fainting or a fainting spell, syncope. You may sometimes feel nauseated, nauseated, or vomit when you are lightheaded. Vertigo is a feeling that you or your surroundings are moving when there is no actual movement. You may feel as though you are off balance, spinning, whirling, falling, or tilting. God damn. When you have severe vertigo, you may feel very nauseated or vomit. You may have trouble walking or standing, and you may lose your balance and fall. Wow. The most craziest thing that I ever heard of. Although dizziness can occur in people of any age, it is more common among older adults. A fear of dizziness can cause older adults to limit their physical and social activities. Dizziness can also lead to falls and other injuries. Lightheadedness. It is common to feel lightheaded from time to time. Brief episodes of lightheadedness are not usually the result of a serious problem. Lightheadedness often is caused by a momentary drop in blood pressure and blood flow to your head that occurs when you get up too quickly from a seated or lying position. Orthostatic hypotension. Ongoing lightheadedness may mean you have a more serious problem that needs to be evaluated. Lightheadedness has many causes, including allergies, illnesses such as the influenza, flu, or colds. Home treatment of your flu and cold symptoms usually will relieve lightheadedness, vomiting, diarrhea, fevers, and other illnesses that cause dehydration. That's crazy. Very deep or rapid breathing. Holy moly. Hyperventilation, anxiety and stress, the use of tobacco, alcohol, or illegal drugs. A more serious cause of lightheadedness is bleeding most of the time. A more serious cause of lightheadedness is bleeding most of the time. The location of the bleeding and the need to seek medical care are obvious, but sometimes bleeding is not obvious. Occult bleeding. You may have small amounts of bleeding in your digestive tract over days or weeks without noticing. The bleeding, when this happens, lightheadedness and fatigue may be the first noticeable symptoms that you are losing blood. Heavy menstrual bleeding also can cause this type of lightheadedness. Sometimes the cause of lightheadedness is an abnormal heart rhythm, arrhythmia, which can cause fainting. Spells, syncope, unexplained fainting, spells need to be evaluated by a doctor. You can check your heart rate by taking your pulse. Many prescription and non-prescription medicines can cause lightheadedness or vertigo. The degree of lightheadedness or vertigo that a medicine causes will vary. Vertigo occurs when there is conflict between the signals sent to the brain by various balance and position sensing systems of the body. Your brain uses input from four sensory systems to maintain your sense of balance and orientation to your surroundings. Vision gives you information about your position and motion in relationship to the rest of the world. This is an important part of the balance mechanism and often overrides information from the other balance sensing systems. Sensory nerves and your joints allow your brain to keep track of the position of your legs, arms, and torso. Your body is then automatically able to make tiny changes in posture that help you maintain your balance. Proprioception. Skin pressure sensation gives you information about your body's position and motion in relationship to gravity. A portion of the inner ear called the labyrinth, which includes the semicircular canals, contains specialized cells that detect motion and changes in position. Injury to or diseases of the inner ear can send false signals to the brain, indicating that the balance mechanism of the inner ear labyrinth detects motion. Of these false signals conflict with signals from the other balance and positioning centers of the body. Vertigo may occur. Common causes of vertigo include inner ear disorders such as benign, BENIGN, don't know, and paroxysmal, PAROXYSMAL, don't know. Positional vertigo, BPPV, Meniere's disease, MENIERES disease, vestibular neuritis, NEURITIS, or labyrinthitis, LABYRINTHITIS. LABYRINTHITIS. Don't know. Injury to the ear or head. Migraine headaches, which are painful, debilitating headaches that often occur with vertigo, nausea, vomiting, and sensitivity to light, noise, and smell. Decreased blood flow through the arteries that supply blood to the base of the brain. The vertebrobasilar insufficiency, Less common causes of vertigo include a non-cancerous growth in the space behind the eardrum, cholesteatoma, cholesteatoma, brain tumors, tumors, and cancer that has traveled from another part of the body. Metastatic, that's the one. Immediate medical attention is needed if vertigo occurs suddenly with a change in speech or vision or other loss of function. Vertigo that occurs with loss of function in one area of the body can mean a problem in the brain, such as a stroke or transient ischemic attack. Transient ischemic attack. Transient. The word. Next word. Ischemic. Attack. Alcohol in many prescription and non-prescription medicines and cause lightheadedness or vertigo. These problems may develop from immediate medical attention is needed if vertigo occurs suddenly with a change in speech or vision or other loss of function. Vertigo that occurs with loss of function in one area of the body can mean a problem in the brain, such as a stroke or transient. Okay, alright. I already read that part already. TIA. Alcohol and many prescription and non-prescription medicines can cause lightheadedness or vertigo. These problems may develop from taking too much of a medicine, over-medicating, alcohol and medicine interactions. This is a problem, especially for older adults who may take many medicines at the same time. Misusing a medicine or alcohol use disorder, drug intoxication, or the effects of withdrawal. Check your symptoms to decide if and when you should see a doctor. I got 3 more pages to go, and then we're done. Dizziness. Overview. Dizziness is a term used to describe a range of sensations, such as feeling faint, woozy, weak, or unsteady. Dizziness that creates the false sense that you or your surroundings are spinning or moving is called vertigo. Dizziness is one of the more common reasons adults visit their doctors. Frequent dizzy spells or constant dizziness can significantly affect your life, but dizziness rarely signals a life-threatening condition. Treatment of dizziness depends on the cause and your symptoms. It's usually effective, but the problem may recur. Symptoms. People experiencing dizziness may describe it as any of a number of sensations, such as number 1, a false sense of motion or spinning, vertigo. Number 2, lightheadedness or feeling faint. Number 3, unsteadiness or a loss of balance. Number 4, a feeling of floating, wooziness, or heavy-headedness. These feelings may be triggered or worsened by walking, standing up, or moving your head. Your dizziness may be accompanied by nausea or be so sudden or severe that you need to sit or lie down. The episode may may lie may LA something seconds or days and may recur. LA something lack. The episode may lack seconds or days and may recur. Lack or something. I mean, I don't know, but let's see if I'm right, but who knows. When to see a doctor. Generally, see your doctor if you experience any recurrent, sudden, severe, or prolonged and unexplained dizziness or vertigo. Get emergency medical care if you experience new severe dizziness or vertigo along with any of the following. Number 1, sudden severe headache. Number 2, chest pain. Number 3, difficulty breathing. Number 4, numbness or paralysis of arms or legs. Number 5, fainting. Number 6, double vision. Number 7, rapid or irregular heartbeat. Number 8, confusion or slurred speech. Number 9, stumbling or difficulty walking. Number 10, ongoing vomiting. 11, seizures. 12, a sudden change in hearing. 13, facial numbness or weakness. Okay? See this here? Because I couldn't even quite read that part. You know, it says LA something. You know, see that? Cause there's a blue part in the way. So if you want to see what it says, just go online and type up what is lightheaded, and then and you will see the whole words and the other objects. You know, and you can click on that one. Once you click on that, and it's gonna tell you the whole thing of everything what it means. That's because I did a whole screenshot of this. I did a screenshot of this here. I did a screenshot of every other paragraph from here and through all those pages. See, here and here and here and here. I did all the screenshot on my phone right there, like the one I'm recording now. And then I print them from the printer off of my phone. All right, folks. So, see you later.